Sleeping sickness is a life-threatening disease that afflicts poor people, mostly in rural areas. The disease is carried by tsetse flies. In Africa, the disease has for long tormented communities in West, Central and East Africa, where two different variants of the disease were rife. Uganda joins Benin, Togo and Rwanda to validation from the World Health Organization that at least one form of human African trypanosomiasis has been eliminated as a public health problem. On the April 24, 2022, Uganda received a letter from the World Health Organization that it had eliminated Gambiansi type of sleeping sickness and it was no longer a public health concern. Since the 1920s, Uganda has been implementing interventions to eliminate sleeping sickness. Uganda is the only country where both forms are endemic, but has now achieved the elimination of the Gambiansi type of sleeping sickness. Rhodensi form of sleeping sickness, which is rampant in central and southern regions, is yet to be eliminated. Dr. Bai Fatumbi, the World Health Organization country representative, explains the criteria for validation of elimination.
We will have been watching the pattern of your data, and we must be sure that your data is credible. And when we now look at the data in a very credible manner, we will also look at reports, program reports. What are the interventions that you will put in the dossier? Then we go through the dossier. Dossier is always very tough to prepare. It could take.
Dr. Albert Mogeni from the Ministry of Health says insecurity in some areas can affect the operations.
Much as this is number 10, it must be addressed. Otherwise, we get back into the problems.
According to Dr. General Thacheng, the health minister, Uganda has no cases of sleeping sickness Gambianese type, much as it can reoccur if frontline health workers relax.
Because we still have threats coming from South Sudan and from the DRC that still have it. It therefore means that we have to intensify our efforts in surveillance and pick out cases immediately it occurs. But how do we do this? It means the cross-border collaboration must continue so that working together with our colleagues on the other side of the borders from South Sudan and DRC, we ensure that no cases cross back into Uganda.
She adds, Uganda has made efforts in eliminating some of the neglected tropical diseases like neonatal tetanus, geinworm, and now Gambiansi type of sleeping sickness.
We have the acute type, rhodesiense, that is majorly in some of the areas in Kyoga and Busoga region. It is time to rise up and get rid of them because they are a socio-economic issue affecting our cattle and affecting the livelihoods of the people.
Safi Mokili Baluku and Shamim Natewa, CTV, Pimentation.
The next one.